Cody Whitefoot, physical therapist and instructor in the Department of Physical Therapy here at UTHSC. My focus is using active learning strategies to equip students to think like healthcare professionals. In healthcare education, we do an exceptional job of telling students how to succeed as healthcare professionals. The problem I've noticed is we spend so much time telling students how to succeed as healthcare providers, we often don't equip students to practice and clinically reason like healthcare providers. In physical therapy education, for example, I know that I've failed many times by just presenting students with factual information, how to evaluate patients, how to set goals for patients, and how to create an effective intervention program for these patients. And then when it comes time for these students to actually treat patients in real life, they often fail to apply these skills and concepts in a very effective way, like a healthcare professional would. That's why I've begun using case-based learning in a group environment in my class sessions. Case-based learning provides students with real-world examples that allows them to treat patients as if they are healthcare providers in a very low-risk environment. In my classrooms, for example, I'll first begin these activities by grouping students into about groups of 2 or 3. Groups of 2 or 3 really helps to foster a tight-knit discussion and allows students' voices to really be heard in what they think answers to the case potentially could be. Secondarily, I think it helps to solidify some of the information that we've discussed in prior lectures. Now, after we go through grouping, students will go through 3 phases of our case-based learning activities: the pre-brief, the content response, and then the debrief. During the pre-brief, I spend about 5 to 10 minutes highlighting important facets of the case that are of specific clinical relevance. For example, in a recent therapeutic exercise course, we looked at Maria, a 22-year-old tennis player with shoulder pain, including things like her range of motion, her strength scores, as well as pre-existing psychosocial factors that she presents to the clinic with. Following, we go into a content response time where students have about 60 to 75 minutes to respond to the case. In this situation, they responded to Maria's case in creating a 4-week in-clinic progression based on her exercise needs. After this time, we come back together for a time of debrief where I spend about 15 to 20 minutes asking students general questions about the case. For example, how did you progress from week 1 to week 4, the patient's intensity for exercise? In week 4, how did you address Maria's need to return to tennis? Or how did you address the psychosocial factors that Maria was presenting in the clinic with? And did it change your mind at all in what exercise selections you provided for her? And so on. The feedback from students has been great with these case scenarios. Students consistently say things like, I feel like I'm actually starting to think like a healthcare provider, or I've never really had the opportunity to treat a patient like a real PT before, and this is my first exposure to that. The nice thing too is these case scenarios are not specific for the field of physical therapy. They can be applied to nursing, dentistry, or even medicine, applying very specific cases for the profession as a whole or for very specific course content. So the next time you're thinking, I'm so tired of telling students how to be a healthcare provider, I really want to instead equip them to think like, reason through, and practice as if they are the healthcare provider, consider using group case-based learning activities. Thanks for listening.